Hi, I'm Megan. I'm a OCD coach and licensed therapist, and I wanted to show you today how to actually do ERP. So if you have done some research into OCD, you'll kind of see that over and over again, ERP is constantly told as the really best evidence-based approach for OCD. It's the first line therapy and it's very effective in treating it and actually getting people that symptom reduction. However, it can also be really overwhelming to start reading about, and naturally, it's a pretty anxiety-producing concept. So I wanted to kind of break it down so you would actually see what ERP actually looks like, how you would implement it, and how you can do this at home. So I'm going to go ahead and show you a quick exercise on how you could actually do this. So I'm going to pick more of a health OCD theme, but obviously you are going to choose whatever is the theme or the style of intrusive thought that actually bothers you and your OCD the most. But if I am doing a health theme, let's say I'm going to do a simple word-based or writing exposure. So this is it's a great exposure. You can do it for the majority of OCD themes. So I'm going to do a writing exposure and I'm going to write one of the intrusive thoughts, one of the things I don't like thinking about with health OCD. So I'm going to put down, what if I have cancer? So very unsettling thought, not a pleasant one. So I'm just writing that down on paper, all right? Now, when I start ERP, I'm going to be really focusing in on this. You're going to continue to look right at the page and what it looks like internally. So I'm going to think out loud so you have a better idea of what that actually looks like when you're doing an exposure, but obviously pretty much all of this could be done silently. So instantly, my brain goes to, oh my God, yeah, what if I do have cancer? You have a family history, your aunt had cancer. What if, cancer is genetic? What if you have cancer? Now, part of exposure therapy this is the exposure, right? I've brought this intrusive thought up, but the other part is response prevention, right? It's about sitting through the uncertainty and distress without engaging in the compulsion. So when I get that question, right, that, oh, your aunt has cancer, what if you have cancer too? I'm going to practice not engaging with that. So I'm just kind of acknowledging like, yep, that's an intrusive thought. That's a question. I don't have to answer that one. Right? And it's just going to kind of repeat. That thought might be really loud. It's probably going to kind of keep almost barking at me. But OCD or cancer has a big genetic component. If there's a huge genetic component, that means you have high chances. And what if that means you have cancer right now and you're not doing anything about it? And again, I'm going to do my best to kind of sit with it and really acknowledge that it's going to be really physically uncomfortable, right? Like, oh, I really want to know. It doesn't feel okay that, this thought is just here. It almost feels like if I don't get rid of this thought, like I'm not going to be safe. It feels like if I can't feel more sure about this, that I'm not going to be able to move on. So that's what OCD's kind of telling me, and that's the physical feeling it's bringing up, is like, you have to do this, you can't move on. But I'm resisting. So it wants me to reassure myself. It wants me to go through all the facts about cancer that I know, and it wants me to check my body right now too. So maybe one of the compulsions it really wants is like, let's see, are there any signs of cancer in your body right now? Do you feel weird? You've kind of felt some lower back pain for a while. What if that's actually some kind of tumor? I'm going to keep looking at the phrase. I'm continuing to sit with the uncertainty. I'm not answering those questions. So I'm really resisting it. Because I'm doing a good job of resisting it, OCD is now going to kind of double down. So this is where sometimes the intrusive thoughts get even worse. It's going to like the worst case scenario because I haven't given it the attention. So it's noticing, hey, Megan's not ruminating the same way she would. Let's up the ante. So now it's kind of going to give me intrusive images. So let's say I'm still reading the phrase, but now it's showing me images of me passing away from cancer. It's showing images. What if you pass away and then your daughter ends up alone, right? And then there's no one there to take care of her. And, it ruins her life because she was traumatized from you passing away from cancer. So now it's giving me almost this mental story. So I'm going to continue to sit with it. I'm not really going to change anything just because the thought has changed to this kind of worst case scenario. I'm going to continue to resist, which is, okay, yeah, that's a possibility. Doesn't mean I have to get rid of this thought. My whole body feels as though if I let this thought continue, it's going to happen, right? I can't be safe. Something's going to be wrong with me unless I can disprove it right now. But that's not entirely true. That yes, it's a possibility, but me thinking about it has nothing to do with the probability of it happening, right? So even though it feels unsafe, we know it's not. So I'm going to keep sitting with the image. I'm going to just kind of let it play, almost like I'm watching a movie. I can even give it a name. Sometimes externalizing it helps, right? That this is the Macon Gets Cancer movie. I'm going to watch it almost like it's a Lifetime movie where it's going to be really dramatic and really cheesy. And my goal is just to not respond, not to buy into it, all right? Because now it wants me to strategize. It wants me to come up with, well, you need to get your will sorted out, and you need to talk with your parents about what would happen if your daughter died, and you need to come up with a plan, and maybe you should reach out to an estate planning lawyer, and this is probably going to happen. Maybe you should go see the doctor now. So I'm going to just sit with that uncertainty. It's really uncomfortable. It's not fun, but I'm seeing it through, right? That, you know what, this is a possibility. I have to accept that it's possible, but I don't need to strategize. I'm not going to give this thought more attention besides just acknowledging, yeah, that could happen. It could happen, but I don't need to fix anything right now. I don't need to solve anything. I don't need to plan. And now this can take a long time. I will say usually when I have clients do exposures, we do it for about 30 minutes for a really intense one. Our goal is for to wait for the distress to come down. So that might take a little bit. Usually I end it around 30 minutes. So we're going to kind of fast forward this one for, just since it's more of an exercise. So I'm going to continue to resist that. The movie's going to play of this worst case scenario. It might even shift a little bit to like, well, if you don't have cancer, what if you have something else? What if you have something else? What if, you have a brain tumor? What if you end up getting a heart attack instead? So it might continue to shift a little bit, and that's normal. I would treat it the same way, where it's just, okay, that's a possibility, but I don't need to do anything about it, right? Until it fades. Eventually, OCD will kind of stop if you are not doing compulsions, if you're not answering the questions. OCD will get very repetitive. So this thought will just kind of keep looping, and at a certain point, it will start to get boring. That is what we are looking for. So you are waiting until these words, what if I get cancer, are boring to you, until it just feels like words on a page, until it doesn't feel like something you have to get rid of to be okay. So let's say I waited, and it probably took 30 minutes straight, because maybe this is a really intense exposure if I have health anxiety. So I've now waited, and now I'm at the point where I haven't responded to this thought. I haven't given it any attention. OCD's gone through a few different cycles of, but what if you have this, but then what would happen? So I've kind of reached almost the end where the thoughts are still kind of there, but they're almost background noise. It's like a movie playing in the background. Like, yes, it's there, but it just doesn't bring a response anymore. So that is what we are looking for, and that's how I'm going to know I'm done. So that would be a successful exposure for this intrusive thought. Now, obviously, if you have OCD, you're probably not going to stop at just this exposure. You would be doing multiple exposures, and you would be doing them progressively. So I would start, if I have never done one before, I would start with something easier, something lower level, and I would work my way up to more challenging exposures. But this is just to give you an example, right, of here's what it would actually look like. Because I think that's the hardest part, is it's easy to go online and find exposure hierarchies. It's easy to look up what you should do, but to actually get a look at how do you actually do that, and what does it look like to do the response prevention? Because I think that's the hardest part, is what it looks like to do the exposure, but the actual response prevention feels very mysterious. So hopefully this was helpful. If you have tried exposure therapy and you're still struggling, please reach out. I am an OCD coach, and I will help people through being able to actually figure out exposure work if you're struggling. So reach out if you do need some help, but hopefully this is helpful for getting you started. Thanks so much.